Hello, and welcome back to Ambition Focus. Today, we're going to talk about something you see every single day, your skin. After 60, your skin changes in ways that are completely natural. But did you know that your skin can also tell you important things about what's happening inside your body? Think of your skin as a window. It's the largest organ you have, and it's constantly sending you messages about your health. Some of these messages are easy to understand. Others need a closer look. In the next 20 minutes, we're going to walk through what your skin might be trying to tell you. We'll keep things simple and clear, and most importantly, we'll talk about what you can do to take care of yourself. So, let's get started. First, let's talk about why your skin changes as you get older. This is completely normal, and it happens to everyone. After 60, your skin produces less collagen. Collagen is what keeps your skin firm and elastic. When you have less of it, your skin becomes thinner and more delicate. You might notice it takes a little longer for cuts or bruises to heal. That's because the repair process slows down naturally with age. Your skin also holds less moisture than it used to. The oil glands under your skin don't work quite as hard anymore. This is why many people notice their skin feels drier, especially in the winter months. Blood circulation slows down a bit too. This means your skin doesn't get quite as much oxygen and nutrients as it once did. You might see this show up as a change in your skin tone or how quickly your skin bounces back when you press on it. All of these changes are part of the natural aging process. But sometimes, your skin shows signs that point to something more specific. Something that might need attention, and that's what we're going to explore together. Let's start with something many people notice. Dry, flaky skin. Now, dry skin is common after 60. We just talked about why that happens. But if your skin feels extremely dry, no matter how much lotion you use, it might be telling you something. Persistent dry skin can be a sign that your thyroid isn't working quite right. Your thyroid is a small gland in your neck that controls your metabolism. When it slows down, which doctors call hypothyroidism, your skin can become very dry and rough. You might also feel more tired than usual or notice you're more sensitive to cold. Extremely dry skin can also point to dehydration. As we get older, our sense of thirst isn't quite as strong as it used to be. You might not feel thirsty even when your body needs water. If your skin feels tight and papery, especially in your arms and legs, try drinking more water throughout the day. Aim for about 6 to 8 glasses unless your doctor has given you different advice. Sometimes, very dry skin with itching can be related to diabetes. When blood sugar runs high, your body tries to get rid of the extra sugar through urination. This can lead to dehydration, which shows up in your skin. If your skin stays very dry even after you've tried good moisturizers and drinking more water, it's worth mentioning to your doctor at your next visit. Next, let's talk about changes in your skin color. These changes can be subtle, or they can be quite noticeable. If you notice your skin taking on a yellowish tint, especially in the whites of your eyes, this could be a sign of jaundice. Jaundice happens when there's too much bilirubin in your blood. Bilirubin is a yellow substance that comes from the breakdown of red blood cells. This can point to problems with your liver or gallbladder. If you see this yellow color developing, it's important to call your doctor right away. On the other hand, if your skin looks paler than usual, this might suggest anemia. Anemia means you don't have enough healthy red blood cells to carry oxygen throughout your body. You might also feel weak, tired, or short of breath. Anemia can happen for many reasons, including not getting enough iron, vitamin B12, or folic acid in your diet. Sometimes, you might notice a grayish or bluish tint to your skin, especially around your lips or fingertips. This is called cyanosis, and it means your blood isn't carrying enough oxygen. This needs immediate medical attention, so don't wait. If you see this change, dark patches on your skin, especially on your neck, armpits, or in skin folds, can sometimes be a sign of insulin resistance. This is when your body has trouble using insulin properly, which can lead to type 2 diabetes. These patches, called acanthosis, nigricans, feel velvety to the touch. Now let's discuss bruising and healing. If you find yourself bruising more easily than you used to, or if small cuts and scrapes take a long time to heal, your skin is definitely trying to tell you something. Frequent bruising can happen simply because your skin is more delicate now. The cushioning layer of fat under your skin gets thinner with age, so there's less protection for your blood vessels. But if you're getting large bruises from very minor bumps, or if you're bruising without any injury at all, this could point to a problem with blood clotting. This might be related to certain medications you're taking. Blood thinners like warfarin or aspirin make it easier to bruise. If you've recently started a new medication and notice more bruising, mention this to your doctor. Easy bruising can also be a sign that you may not get enough vitamin C or vitamin K in your diet. Vitamin C helps build collagen, which keeps your blood vessels strong. Vitamin K helps your blood clot properly. When it comes to slow healing, this is often connected to circulation problems. If blood isn't flowing well to an area, it can't deliver the oxygen and nutrients needed for healing. People with diabetes often experience slow healing because high blood sugar damages blood vessels and nerves over time. Slow healing can also be a sign that your immune system isn't working at full strength. Your immune system is what fights off infections and helps your body repair itself. If wounds aren't healing within a couple of weeks, or if they look infected with redness, warmth, or pus, call your doctor. Let's move on to itching. Itchy skin can be incredibly frustrating, especially when there's no visible rash or obvious reason for it. Sometimes itchy skin without a rash is simply due to dry skin, which we talked about earlier. But persistent itching all over your body, the kind that keeps you up at night, can indicate something more. This type of itching can be a sign of kidney disease. When your kidneys aren't filtering waste properly, toxins can build up in your blood. This can make your skin feel itchy all over, even though your skin looks perfectly normal. Itching can also be related to liver problems. When your liver isn't working well, bile salts can build up under your skin, causing intense itching. This itching is often worse at night and might start on the palms of your hands and soles of your feet before spreading. Sometimes generalized itching points to blood disorders or even certain types of cancer, such as lymphoma. This isn't meant to scare you. These conditions are less common, but persistent. Unexplained itching that doesn't respond to lotions or allergy medications deserves a conversation with your doctor. Itching can also be a side effect of medications, certain blood pressure medications, pain relievers, and even some antibiotics can cause itching as a side effect. The key here is persistence. If you've had itchy skin for more than 2 weeks and you can't figure out why, it's time to get it checked out. Now, let's talk about swelling. You might notice puffiness in your face, especially around your eyes when you wake up, or you might see swelling in your ankles and feet, particularly at the end of the day. Some swelling is normal. Sitting or standing for long periods can cause fluid to pool in your lower legs. This usually goes away after you rest with your feet elevated, but persistent or sudden swelling can point to important health issues. Swelling in your legs and ankles can be a sign that your heart is unpumping blood as efficiently as it should. This is called congestive heart failure, though the name makes it sound more dramatic. Your heart is still working, but it needs some help. The swelling happens because fluid backs up in your veins and leaks into the surrounding tissue. Swelling can also indicate kidney problems. Your kidneys are responsible for removing extra fluid from your body. When they're not working well, fluid builds up. You might notice puffiness around your eyes in the morning, along with swelling in your legs. Blood clots can cause sudden swelling in one leg. This is called deep vein thrombosis, or DVT, for short. If you notice one leg suddenly becoming swollen, warm, red, or painful, this is an emergency. Call your doctor right away or go to the emergency room. Sometimes swelling is related to medications. Certain blood pressure medications can cause ankle swelling as a side effect. If you started a new medication recently and noticed new swelling, let your doctor know. Let's discuss changes in how your skin feels. Texture changes can be subtle, but they're worth paying attention to. If your skin feels thick and tight, almost like leather, especially on your fingers and hands, this could be a sign of scleroderma is a condition where your body produces too much collagen, causing your skin to harden. It can also affect internal organs, so early detection is important. Rough, bumpy skin that looks like goosebumps but doesn't go away can be a sign of keratosis. This is usually harmless, but it can sometimes indicate that you're not getting enough vitamin A in your diet. If you notice your skin becoming very soft and velvety in certain areas, particularly in skin folds, and if these areas are darker than the surrounding skin, this might be acanthosis nigricans, which we mentioned earlier. This is often associated with insulin resistance. Sometimes your skin might develop small, raised bumps that look like tiny pearls. These are called xanthomas, and they're actually cholesterol deposits under your skin. They can appear on your eyelids, elbows, knees, hands, or feet. Xanthomas are a sign that you have high cholesterol or high triglycerides, which increases your risk of heart disease. Skin that feels unusually warm to the touch, especially if it's also red and tender, might be infected. This is called cellulitis, and it needs prompt treatment with antibiotics. Now let's look at rashes and spots that might appear on your skin. A rash that appears as a ring or arc with clearer skin in the middle is often ringworm. Despite the name, it's not caused by a worm, but by a fungus. It's treatable with antifungal cream. A painful rash that appears on just one side of your body, often in a band or stripe pattern, could be shingles. Shingles is caused by the same virus that causes After you've had chickenpox, the virus stays dormant in your nerves. As you get older, your immune system weakens, and the virus can reactivate. If you think you might have shingles, contact your doctor quickly. Treatment works best when started early. Small red or purple spots that don't fade when you press on them are called These tiny spots are caused by bleeding under the skin. They can indicate a problem with your blood clotting or your platelet count. If you notice these appearing, especially if you're also feeling unwell, call your doctor. A butterfly-shaped rash across your nose and cheeks can be a sign of lupus, an autoimmune disease. This rash often gets worse with sun exposure. Lupus affects more than just your skin. It can affect your joints, kidneys, and other organs. If you notice this type of rash, along with joint pain or fatigue, talk to your doctor. Age spots, also called liver spots, are flat brown spots that commonly appear on areas exposed to sun over the years. These are usually harmless, but it's important to know the difference between an age spot and something more concerning like melanoma.
Speaking of concerning spots, let's talk about when you should worry about moles and skin growths. Most moles are harmless, but changes in existing moles or new moles that appear after 60 deserve attention. Doctors use something called the ABCDE rule to evaluate moles. A stands for asymmetry. If you drew a line through the middle of the mole, the two halves should look roughly the same. If they don't, that's asymmetry. B stands for border. The edges of the mole should be smooth and even. If the border is irregular, scalloped, or poorly defined, that's a warning sign. C stands for color. A normal mole is usually one shade of brown. If your mole has multiple colors, or if the color isn't uniform, pay attention. D stands for diameter. Moles larger than a pencil eraser, about 6 millimeters, should be checked by a doctor. E stands for evolving. Any mole that's changing in size, shape, color, or texture needs to be examined. You should also watch for any spot that looks different from all your other spots. Doctors call this the ugly duckling sign. Skin cancer is very treatable when caught early. After 60, your risk for skin cancer increases because of all the sun exposure you've had over your lifetime. Check your skin regularly. Use a mirror to see areas you can't normally see, or ask a family member to help you. If something concerns you, don't wait. Schedule an appointment with your doctor or a dermatologist. Your nails are part of your skin system, and they can reveal important health information to if your nails are becoming thick, yellow, and brittle. This could be a fungal infection. Nail fungus is more common as we age because our nails grow more slowly and our immune systems aren't quite as strong. Spoon-shaped nails, where the nail curves upward like a spoon, can indicate iron deficiency anemia. This happens when your body doesn't have enough iron to make healthy red blood cells. White lines across your nails can be a sign of low protein levels in your blood or kidney disease. Small white spots are usually harmless and often result from minor injuries to the nail bed. Dark lines running vertically through your nail can be normal, especially if you have darker skin. But if you notice a new dark line appearing, particularly if it extends into the skin around your nail, have it checked. This can sometimes be a type of melanoma. Nails that separate from the nail bed, a condition called onycholysis, can point to thyroid problems or psoriasis. Clubbing, where the tips of your fingers become enlarged and your nails curve around your fingertips, can indicate heart or lung problems. If you notice changes in multiple nails at once, or if nail changes come with other symptoms like fatigue or shortness of breath, mention this to your doctor. Now that we've talked about what your skin might be telling you, let's discuss what you can do to take care of your skin and your overall health. First, protect your skin from the sun. Even at 60 and beyond, sun protection matters. Wear sunscreen with at least SPF 30 on exposed skin, even on cloudy days. Wear a wide-brimmed hat and protective clothing when you're outside for extended periods. Keep your skin moisturized. Use a gentle, fragrance-free moisturizer right after bathing while your skin is still slightly damp. This helps lock in moisture. Stay hydrated by drinking water throughout the day. Keep a water bottle nearby as a reminder. Eat a balanced diet rich in fruits, vegetables, lean proteins, and healthy fats. Your skin needs vitamins and nutrients to stay healthy. Foods high in omega-3 fatty acids, like salmon and walnuts, can help keep your skin supple. Don't smoke. And if you do smoke, talk to your doctor about quitting. Smoking damages collagen and makes your skin age faster. Check your skin regularly. Once a month, do a full body check. Note any new spots or changes in existing spots. Keep up with your regular doctor appointments. Many of the conditions we've talked about today show up in routine blood work before they cause obvious symptoms. And most importantly, trust your instincts. You know your body better than anyone. If something doesn't feel right, or if you notice a change that concerns you, don't hesitate to call your doctor.
Your skin has been with you for your entire life. It's protected you, kept you warm, and allowed you to feel the world around you. After 60, your skin deserves your attention and care. Remember, most changes you see in your skin are simply part of getting older. They're normal, natural, and nothing to worry about. But your skin is also remarkably good at sending you messages about your internal health. By paying attention to these messages, you're taking an active role in caring for yourself. Don't be afraid to ask questions. Don't worry about bothering your doctor. They want to hear about your concerns, especially when it comes to changes you're noticing in your body. Taking care of your skin is taking care of yourself. and you deserve that care. You've earned it through all these years of life and experience. Thank you for spending this time with us today at Ambition Focus. We hope this information helps you feel more confident and empowered in understanding your health. Take care of yourself, and we'll see you in the next video.